Very good afternoon, everyone. Thank you for the wonderful introduction, sir. Thank you, ma'am, and thank you, Vijita, ma'am, for hosting this. It's a really pleasure to be here, and frankly speaking, very nervous because it's not students, it's all faculties, and not just faculties. You are doctors, like not our kind of doctors. You are like doctors. So I am very nervous. So myself, Dr. Lokesh, and I'm currently in CDHPM, Center for Digital Health and Precision Medicine, a small team, a research center that is located in the new building. And the team is very small. As of now, we have only 4 people, including me. We have, if I don't mind, Soumya. So that's a clinical data scientist, Dr. Soumya. We have Jitin, who's an engineer, and Kashit, who's also an engineer, machine learning engineers. So just us 4 now, and the team is growing like slowly. Eventually, we'll be a little bigger, hopefully. And as ma'am rightly pointed, the entire healthcare is moving towards digital health and precision medicine. Just to save the battery on your laptops, I think you can close the laptops for now. For the first 1 hour is going to be lecture. Then we can go into the laptops because by the time you will all be searching for blood points, and we don't have any blood points here much. So I was told you're all new to AI and machine learning. So forgive me if the talk is too basic. I prepared it with the understanding that you're all very new, but I see some of the senior faculties and I'm sure you know more than this, what is given here. So apologies if it is too basic. So the idea today is that the entire healthcare, that is Apollo as a healthcare provider, service provider, our own healthcare services is majorly being taken over by automated services into digital health and precision medicine. However, precision medicine is still not into it. Digital health is what we keep hearing the word AI and ML multiple times. By the end of this presentation, what I want to give you an understanding is that what is AI, what is ML, what do they basically do? Like why do you need to use them, and what do they basically do? That's as simple. My objective for today is just that. What is AI and what is ML? It's not going to be going into coding, we're not going to be doing any algorithm building, we're not going to be making anything new. It's going to be a basic understanding and a small hands-on how you can train a small computer to do. Like how you can train a dog to say sit, stand, that's all, bark, speak. So like that, you can train the computer to do a certain specific task. Very simple task for this matter. So that's all the objectives for today. So with that brief outset of the objectives, first thing is, why do we need AI in healthcare? Right? I'm sure all of you are experienced doctors, clinicians with so many years of experience, but despite there being experts in our field, there is still a lot of hospital errors are happening. And this is according to US records. We have about 0.7% of adults or hospital patients going to hospitals are being misdiagnosed or being delayed in diagnosis or given the wrong treatment, because of which several severe side effects or adverse effects take place. And 6.6% of patients who die are due to misdiagnosis or misdiagnosis or delayed diagnosis. So AI is not here to replace clinicians. It is to improve the efficiency of the clinicians. So these are some of the types of errors that we usually face in a hospital setup. But why do we need AI or ML, machine learning, in healthcare is that we have to improve the efficiency of the doctors, and we need to improve the diagnostic accuracy. For example, a new doctor coming into the field might not be as experienced as somebody who's been there for 30 years already in the field. So that's what we are trying to deliver to the healthcare professionals to reduce time consumption. We all know that we are overcrowded with patients. In a time where we are supposed to deal with only 5 patients, we will be given 10 patients to work with. So this AI ML tools will help you to reduce the time you spend on each patient, giving you more time for other patients, to improve treatment outcomes. For example, giving a wrong medicine could improve the underlying cause. So These tools will help you to identify the right medicine for a patient so that the treatment outcomes are better. And finally, to prevent hospital errors, that's like overall to prevent that 6% of death that happens due to delayed or misdiagnosis. So with that outset, that why do you need AI or ML? What is AI, right? Artificial intelligence, the word intelligence basically means it's a copy of a human, and what can a human intelligence do? Humans can read, write, recognize, identify, remember, understand, reason, and learn. This is what is different essentially from animals and humans. So human intelligence means we can recognize something, we can learn something, we can apply that learned knowledge somewhere else. That's basically human intelligence. And artificial intelligence is nothing but the same version inside a computer. So if we are going to train a model or a computer, basically a software which can think, for example, ChatGPT, what can ChatGPT do? You give it voice instructions, it can recognize, it can type it out, so it can listen to you, it can read whatever you write, it can draw for you. So, and over time it gets adapted to your style, right? So it will write a letter similar to what you would have written, right? It gets used to your style and it becomes, or it starts adapting to your style. So it's learning from your behavior. So ChatGPT in a way that is one of the artificial intelligence kind of a tool. So what we are essentially trying to do is try to simulate a software to think or behave like human. But we are not completely successful in that right now. Although we are transferring the knowledge that we have gathered. What is AI and ML overall, if you see, is basically gathering of data. Based on existing data, whatever we have, we can develop a new model. In clinics, I think in clinicians, it's very common that a senior faculty would take on a new doctor, and he or she would train that person in the same specialization as he is, right? I'm sure that's how you get specialized in a particular field, whether it's pediatrics or whether it is geriatrics or gynecology or any field of doctors. You usually go under a senior physician or a senior clinician and learn from them, right? That's how you become specialist in a particular field. Instead of that, the senior person is now transferring his or her knowledge into a software. That's basically what is happening in AI or ML. We keep hearing the word machine learning many a times. Machine learning is nothing but it is a subset, or it's a small part of artificial intelligence. It's not better than AI, it is a part of AI. And what ML does is a very, very specific, narrow task. AI is a very broader terminology. It can read, recognize, as I said, it can identify an individual by photos, etc., etc. ML is like a small component of AI which can do a specific task. What it trained, that only it can do. So we'll see in a simple term what is machine learning. So you understood what is AI. It can do multiple tasks. But machine learning is, in a simple way, it's a mathematical equation. We can call it as a mathematical equation, a formula. Let's look at this example of patient's BMI and their risk for cardiovascular diseases. If a patient is obese, obviously the risk increases. If the patient is healthy, then it reduces. So it's a direct proportion. It's a direct, the two variables are directly proportional to each other. There is a direct correlation. Bone density and osteoporosis. As the bone density decreases, the risk for osteoporosis increases. Yes. And visceral fat and diabetes. As the visceral fat increases, the risk also increases. So this is easy said than done. But any patients you're coming into your hospital, we are not going to say, okay, your BMI is high, so you are going to have a heart attack. It's not that simple. So, in a simple words, yes, machine learning is a calculator. It's basically a formula that it tries to establish between two variables, and it uses correlation and regression. right? Correlation to understand what is the relationship between one variable to the other, that is input to the output. And it uses regression to predict what would be the outcome given this is the variable. If a patient comes in with a BMI of this much, what would be the risk of that patient having a heart attack in the next 5 years or the next 10 years? But clinical symptoms are not going to be as simple as that. Clinical symptoms are not dependent on one variable. It depends on many parameters. It's a multifactorial condition. So, as a machine learning model or a machine learning algorithm or a program, it is not taking one variable into account. It is taking hundreds of variables or as many as you give. It can find out the correlation between all the variables to that one outcome that you are trying to predict. If you are trying to predict the risk of a cardiovascular disease, it will only try to predict what is the risk of cardiovascular disease to happen in this particular individual, given these are all the variables that you are giving. If you don't give a certain variable, then the risk that is calculated will be less because you are missing some parameters in the formula. Right? Is it making sense? So machine learning is not actually a larger scale. It cannot do everything. It can do a specific task only to recognize. If you are developing a machine learning model to scan X-rays, it can only read X-rays. It cannot read anything other than that. If you are developing a machine learning model to predict cardiovascular disease, it will only do that. It cannot do anything else. So, it is a series of complicated mathematical equations that are difficult to understand and or comprehend by a normal human brain. It takes in multiple parameters, takes into account the correlation between the parameters, and finally performs a regression and gives you an outcome. This is the prediction. Can AI or ML replace doctors? You're all doctors, so can it replace you? That's one thing. And second, how reliable do you think a AI or an ML tool is? How much can we believe the prediction that is given by a AI ML tool? For the first, all three of these images, they all look kind of similar. For someone who has not seen any of these images, do you think that they will think they are all same? They are all similar in one aspect, but they differ in multiple aspects. Right? They are like the source, one is animal, one is vegetable, another one is nut. And the texture, color, there is a lot of different variants. But if you show this to a child who has not seen any of this before, he or she would say probably they are all same. Right? So, because they are similar, for example, the color is same for the wallet and the brain. I cannot say that both of them are same. Why I quoted this example is because patients are like the same. Each of the patients and the symptoms and the conditions or the diseases that you are experiencing, it's not same. Each patient has his or her own diversity of variations into the biology. Many of the diseases are multifactorial. There are direct and indirect contributing factors. Demographic and geographic parameters, comorbidities. The patient could be having diabetes while you are treating her for cardiovascular diseases, or she could be antibiotic sensitive when you are trying to treat a bacterial infection. Several comorbidities has to be taken into account, whether they are vegetarian, vegan, etc., etc. Food habits, lifestyle, obesity directly correlated to lifestyle. So all these has to be taken into account. Sadly, the AI or ML has not evolved that much to take all this into consideration. As of now, it is a robot which can perform a specific task. It cannot think or it cannot take into account all of these factors. That is why, as of now, AI ML cannot replace a doctor. Even going forward in the near future, how efficiently it can replace is no guarantee. So for sure, no. AI ML cannot replace a doctor as of now. Thank God. Yes. And it can only be used as a support system. AI cannot make a decision. For example, consider Tesla's automatic car. If it makes the Tesla automatic drive, it crashes, still the owner will be sued. Tesla will not be sued because it is in their terms and conditions. So, as a software developers, we also put terms and conditions. The clinician takes the responsibility for all the outcomes that is given by this, or whatever is that you are going to change your decision. It's up to your personal judgment. So, AI ML cannot replace a doctor, and the predictions that are given by an AI ML is not absolute. It is only suggestive. The clinician, based on his or her experience, has to take the final call. And this especially is very, very important when we are dealing with, or when the doctors are new to the field, like freshly graduated MBBS students or COVID graduated MBBS students, maybe. So, AIML helps the clinicians to do their job better, but not instead of doctors. They can never replace a doctor. So, what is the other question? Whether how reliable can an AIML be? Right? How reliable can a doctor be? How can we say a doctor is good or bad? How good is a doctor? Doctors, please.
It depends on a lot of things.
Depends on.
I mean, one doctor may not be the same as the other. Though
Yes.
the degrees, education, everything may seemingly appear the same.
If both of them are having the exact same number of, say, degrees, number of years of experience, but what would make one doctor better than the other?
More knowledge and
How many patients of that particular condition he or she has treated or addressed? That's exactly the same for machine learning as well. AIML works based on the data that you give to that particular device. How many data it has seen or how many patients it has analyzed will make it a stronger tool. If I am giving 1 lakh patients data to a software and it is trained, now based on 1 lakh patients information, it can give a very good prediction. But let's say I am giving only 100 images, 100 patients data. Which one is more reliable? 1 lakh, obviously, right? That is exactly why this field is having a demand. The data is a demand. From every hospital, accumulation or like resourcing the data is one of the biggest business that's going on in the hospital right now. Our own Apollo, we are the most richest in the world because Apollo has more than 17 years of EHR, that's electronic health records, which no other system in the entire globe has. We are the only country who has started electronic health records 17 years before. And we have more than 4.5 crores, now I'm sure it has crossed 5 crores already. So we have 5 crores worth of patients, the treatments, the conditions that they have undergone, whatever the procedures, lab tests, everything. Starting, name it, from a biochemical lab test, urine test, blood test, x-rays, CTs, endoscopies, videos, everything. We have all the records, which makes Apollo one of the richest in the entire globe. Maybe even richer than Elon Musk. Maybe. But we are not selling it, we are trying to apply it. Now what we are trying to do, we are not commercializing that data. We are trying to develop a tool that is more accurate than any other tool in the entire world, and we are trying to apply it in India. Already there are tools currently our Apollo is using for its patients, which we will see in the later part of the slides. But you get an idea now what is ML, what is artificial intelligence, right? Now, given a very broad understanding what is AI and ML, what are all the things that you are going to see as a doctors in this field? Where all do you think AI or ML is going to implement? I'll give you some examples. Then you can see, you can easily relate to your personal experience as well. First thing, and the most popular one, is called as Clinical Decision Support System, CDSS, Clinical Decision Support System. our Alfred sir recently gave a talk in Allied Health Sciences induction. So he said for a surgeon to operate, he needs 16 allied health professionals, like perfusionists, then OT technicians, then you have anesthesiologists, etc., etc. You need 16 different personnel to successfully complete one surgery. But does a physician or a general doctor have any assistants like that? A physician, he just meets the patient, whatever comes to his mind, whatever the fight he had in home, that stress he will take out on the patients. I mean, not technically should not, but he is subjected for the stress, fatigue, like everybody else, right? They are also human. So the stress, fatigue, it hinders their decisions. So these CDSs are softwares, that is machine learning softwares, machine learning modules, which acts as a support system for the physicians to make a better decision for treatment and for diagnosis. I'm sure all of you are familiar with this CDSs. You have heard? Let's see some examples what is currently being used in the Apollo, in all the multi-speciality hospitals of Apollo. We have one tool called EARS, antibiotics. That software helps to recommend a better antibiotic to patients, keeping in mind not to give a chance for development of drug resistance. Because that is one, antibiotic resistance is something that is common happening because of misuse of antibiotics or inconsistent follow-up, etc. This year's antibiotics tool will take into consideration patient history because the patient's EHR is already available, and it will provide recommendations on what antibiotics should be provided for this particular patient so that that particular infection will not become a drug-resistant version. Chest X-ray tuberculosis. This, after taking an X-ray, many a times missed diagnosis is because the evidence is very little or it can escape human eye. Right? The tuberculosis is basically seen as a pus forming in the lungs, in the pulmonary cavity. Right? But if the pus is too little, too small, the clinician could ignore it, saying that it is a noise. If it is too minor or too subtle, it can escape human eye. This software currently being used in Apollo, it can detect even the minutest of the changes in the chest X-ray and detect if the patient is having tuberculosis or not. So based on X-ray. Then early warning systems, EWS, clinical deterioration. A patient is hospitalized and he has just done his operation and he is in the bed for the next 4 days or 5 days. During this time, if the patient undergoes heart attack, or if the patient is having a renal failure, like kidney failure, or severe blood loss, internal bleeding, clinicians or the nurses cannot note it till it's too late, till it becomes too obvious. When the patient goes beep, till that you cannot notice it. But this EWS clinical deterioration tool, it can monitor the vitals, that is, there it is being your saturation, oxygen saturation levels, your ECG, your blood pressure, all the vitals which the patients are connected to, and even the minutest of the change, it will predict and it will say that there is something wrong with the patient, given attention. That's an early warning system. So it gives you an early warning if the patient is about to undergo a heart attack, if the patient is having an internal bleeding, all that it can check. This system, that is clinical decision support system, is based on a patient presenting his or her symptoms to the doctors. This system is only useful when you have a patient. What's a patient? A patient is somebody who has a symptom or some illness that they are trying to present to the hospital. What if the patient is healthy? The patient does not have any symptom. They are just coming in for a regular health checkup. Right? We have to find some way to bill them extra, right? So we have predictive analysis tools. This is another version of AI ML. These softwares or these machine learning tools, they will predict whether a person is going to have a heart attack or not, whether a patient is going to have say diabetes in the near future, based on clinical parameters. Imagine that the patient is coming in for a regular checkup. What are the parameters that we'll count? We'll check for their BMI, we'll check whether they have a blood glucose level, we'll check their HbA1c level, their lipid profile, cholesterol profile, whatever it is. All the regular tests we do, liver function test, kidney function test, etc. Based on all the clinical parameters, this software will predict whether the patient would have a risk of a particular condition. And again, as I said, each tool can predict only for one particular condition. If you design a tool for liver fibrosis, fatty liver, it can only do that. So, similarly, right now in Apollo, we have some softwares, AI CVD, that is artificial intelligence in cardiovascular diseases. This tool can predict whether a patient will have cardiovascular anomalies or diseases or not, based on clinical parameters with a time factor in the next 5 years or the next 10 years. Then you have pre-diabetes AI. Again, if you are going to have diabetes, it can give you a warning 5 years or 6 years before. AI COPD, again chronic obstructive pulmonary disease, it can give you warnings. But what is the main use of this? The previous version, CDSS, it helps us to treat the patient better, yes. But what about predictive analytics? It's not going to treat anything, but based on the recommendations provided by the predictive analytics, we can change the lifestyle of a patient, by which the next 6 years can be extended to next 10 years. Or we can avoid a situation that the patient will never become diabetic at all. Like, we can completely avoid the situation, right? So predictive analytics helps to deliver a better patient care in regards to preventing the incidents happening. CDSS is something that the incident has already happened and you're helping a better treatment. And by the way, this software that I just mentioned, this 3 and another 3 the before, these are all softwares that are developed by our director of CDSPM, Dr. Sujoy Clark and his team, and is directly implemented in Apollo system. And in that pipeline, we have another 20 softwares that are being developed, which will be used for the Apollo health system to improve the patient care and also to make the lifestyle better for all the patients. Now, I'm sure you have all seen something like this. I don't know how many of you are familiar with Pokemon Go? No? Okay, there's a lot of ladies in the house, so you would be knowing Amazon and Flipkart. Try it, virtually try whether this particular furniture fits in your room, whether this particular light fits properly in this particular area, etc. This is called as augmented reality. It takes the reality as into account and it changes one aspect of it and tries to give you a real world experience. Right? That is augmented reality. Reality is same, you're just changing a small part of it. The same thing now, AI/ML is changing augmented or using augmented reality, and it is going to help surgeons operate with a more precision. You take a CT scan or MRI scan of the patient, find out where the tumor is. Before even cutting open the abdomen, it will show you that the tumor is here. Right? Based on the X-ray, it takes the CT and the MRI data, converts it into an augmented reality, shows you the position of the particular object that you are trying to dissect. Let's say it's a biopsy, or let's say it's a removal of a tumor. It will show you exactly where it is. That's using a 3-dimensional coordination. So this requires artificial intelligence in the background for this to run, in the foreground. Then you have another one, I'm sure all of you have seen this in the malls and all, you have virtual games that you put as a big glasses. That's called as virtual reality. Now, just this morning, Alfred sir was mentioning that it's very difficult to get cadavers for the MBBS students to train. So, this AI/ML tools develops a virtual cadaver for you, so that the MBBS students or the surgeons can practice without having to depend on exact cadaver themselves. So, this not actually for treatment, but it's a training the trainer, right? The AI will help to train the doctors better, so the doctors can do a better job when you are actually cutting open a live subject on the table.
virtual reality, again, the background of this is machine learning and artificial intelligence. Now, again, I'm sure all of you are familiar. Alexa enabled home. Alexa, turn on the grinder from here. You can give instruction for washing machine and grinders to your home. And that happens through cloud computing, right? Your mobile is connected to the cloud and your Alexa is connected to the cloud and it sends a signal. Now imagine the same thing in patient setup, in a healthcare setup. You're all now having smartwatches which can detect your SpO2, which can detect your heartbeat, number of heartbeats, which can also detect your stress level. That is one of the parameters that is found in your smartwatches nowadays. However, it's always going to be on with us with all the workload. It will all be in high stress all the time. That is going to be integrated to your health records in Apollo Hospital. Let's say you are a regular customer for Apollo. Your smartwatch can be integrated to your electronic health records, and every time your heartbeat goes very high, let's say you are a hypertension patient. So every time your heartbeat crosses a certain limit, it automatically gets recorded in your EHR. So the next time when you go for a doctor visit after 6 months, the doctor will say, over the last 6 months you had 100 times your BP has gone up to this much. So you need to avoid whatever you are doing, you need to stop doing that. Correct? So this creates a live monitoring. Even though the patient is not actually in the hospital, you can still monitor their vitals or their basic, whatever is the condition that you are looking for, you can. Going forward, this is not going to be an option. Everybody's smartwatch will be integrated into the hospital's EHR, but not immediately. Going forward, maybe another 20, 30 years, it's going to be mandate. Extension of this, assume the same thing, this is currently in practice right now. Remote monitoring. Imagine a patient just got an operation, let's say heart transplant. You cannot keep the patient in the hospital for 5 months or 6 months. You cannot monitor them for that long in the hospital. Imagine the patient has gone home, you have discharged him. But you still need to monitor if something goes wrong in his vital. You have to be able to deliver first aid or first line of treatment, whatever needs to be done, it needs to be done at the earliest. So the same Internet of Things is like your remote devices are currently being used for patients who are having the surgery done or somebody that needs to be monitored for the next 2 to 3 months in a short duration. And finally, the last part of this presentation, and all of you are sleepy. So the last part is precision medicine, which is a major part of CDHPM, that's digital health and precision medicine. Precision medicine is not in practice in India as of now. It is only making its baby steps. That is your genetics, based on genes or based on your genetic makeup, modifying the treatment or recommending the treatment. It is not completely in place, or we are only taking the baby steps as of now. But in UK, every baby that is delivered in the hospital will be undergoing a whole genome sequence. That is part of the mandate now, like how all the other testings will be done, all the other vaccines you are getting for the babies in India. In UK, every baby has to undergo a whole genome sequence. And at that point itself, you can predict whether the baby would be having a risk for cardiac disease, whether the baby will be diabetic, whether the baby will have a liver failure, kidney failure, whatever it is, you can have a prediction. These are not based on your clinical symptoms. So far, whatever we saw, everything was based on clinical parameters. It was either your blood pressure, your BMI, or your cholesterol lipid profile. But this precision medicine is purely based on genome. That is your genetic makeup, which is still not in India, maybe another 10 years, yes. But as of now, this is being implemented in UK and in developed countries like USA and other countries. But we are taking our initial steps in this. So, with all this information I have given, this is very basic, of course this is not advanced, it's very, very basic. How can you contribute? Doctors, the ultimate aim of this talk is that Usha ma'am wants us to all engage in research and all of you to become researchers. You already are, for sure, but to engage engage more in the research or in AI/ML research, how can a clinician do our AI/ML based research? The technical people or the technicians that we have, like engineers and data scientists, ideally we don't know much of biology or medicine as much as you do. So who's going to tell the computer that this is glaucoma, this is kidney stone, this is kidney cyst, or this is fatty liver? Who's going to tell the engineers? They are the engineers, you are the doctors. You know that when you see a scan, X-ray, you can differentiate whether it is a tuberculosis or whether it is anything else, whether it is a broken rib, whether it is whatever is a condition. You are the people who are going to diagnose it. But the engineers are the one who has to train the computer in order to detect it in the future. So as a clinicians, you play a vital role in establishing something called as ground truth. Right? At CDSPM, all the projects we start, none of that, any engineers are leading the project. Clinicians are the lead for the project. Because as a clinician, you can look at an X-ray in a second and go, okay, this is tuberculosis, this is something else, I don't know what else you will have in X-ray, but if you are experienced, you can easily diagnose it. And that's what is called as ground truth, which we will be now training, giving you a hands-on. What does a ground truth mean? And how can a model do something that it does purely based on what we tell the machine to do? Right? Now I'm telling that I can train a model to predict whether X-ray has tuberculosis or not. If I am training that, I have to give the machine first a set of images saying that these images are healthy images, there is no tuberculosis. Then I have to give another set of images to the computer saying that these are the images that are infected, the X-rays with tuberculosis. Now try to differentiate these two, and when I am giving you a third image, which is a patient's image, a random image that is coming in, try to find out whether it belongs to this or it belongs to that. This is as simple as you can explain how clinicians, you will be able to help develop the model. Because you are establishing the ground truth, meaning which is healthy, which is infected, which is damaged, which is failed. All this, only you can tell us, the engineers. So we will be able to tell the machine that this is what is going to, or this is what we want you to predict. Sure, that is clear? Ground truth. Patient recruitment. See, even if we develop the tool, who's going to engage the patients? CDSS or whether it is predictive analytics, you are the first point of contact for the patients. Even if we are developing the tool, we cannot deploy it into the field without clinicians. So you are not only helping us to develop the tool, but also to deploy it. If you don't understand it enough, you won't recommend it to your patients. As much as any medicines that's coming to your, if I'm a salesperson coming in and saying that this medicine is new, you give this to your patients, I'll give you 10% commission. That's not how it works. You would be like, I want to first understand what is there in this medicine so that I can recommend it to my patients. Similarly, if you don't understand the AI tool, you won't recommend this to your patient. So, patient engagement, to see whether this tool actually works or not, you are the first point of contact for us. Then, clinical validation is basically the same thing, whether it works or not. For example, as I said, CDSS can tell this patient, give this particular medicine. But are you happy with that suggestion? As a clinician, are you happy with that? No, you will say, no, definitely I'm not supposed to give this. Your software is making a wrong decision, correct this. Who's going to tell us that if our software is making it wrong? Doctors. Then, scientific stewardship, meaning, as I said in the beginning, the software is designed only to correlate a couple of variables and give a prediction. But as an expert in the field, you will be able to take into account the clinical, the demographic value parameters, the geographic parameters, the lifestyle, whatever the contributing factors for that particular disease, you will be factoring all that in and you will be changing the decision that is given by the computer. So you are having the expertise over that particular domain, and you are the right person to fine tune this particular software. Correct? So you are the vital part of AI and ML, and as a clinician, you are asking a question, what will I do with AI ML? You have everything to do except the coding part. Leave the coding part to the engineers. Except that, everything else is your game. Clinicians are the masters of this particular tool. Only that you don't know coding that anybody can do with use of ChatGPT, but you can guide people to get that done and ultimately develop a software that you think your patients need. All the projects that we are doing at CDSPM right now, none of that are proposed by a technician. None of that is proposed by an engineer. A doctor would come to us and say that I have a problem in predicting this hairline fractures. Right? Many of my clinicians are missing out or in missed cases. They are not able to identify the hairline fractures. Develop a software that picks up on the hairline fracture that a human eye can miss out. So a clinician